Hello, my name is Leanna Price, and today's snippet is on ankylosing spondylitis. Ankylosing spondylitis is a type of spondylar arthropathy, say that 5 times fast, which is a type of arthritis that attacks bones in the spine and joints, often resulting in inflammation and joint damage. Ankylosing spondylitis is a type of autoimmune disorder which impacts the spine, the sacroiliac joints, and surrounding soft tissues, and is caused by chronic inflammation. Usual age of onset is between 20 and 30 years of age and starts with a chronic low, dull backache. The hallmark symptom of ankylosing spondylitis is morning stiffness. This is better known as spinal rigidity. Patients can present with a hunched over posture caused by the spine fusing. This symptom is often progressive and worsens with age. The other major symptoms are pain in the back, hip, buttocks, and joints. Typically, pain is felt at rest or while sitting and improves upon standing and walking. Patients also complain of fatigue and IBS symptoms. As the disease progresses and rigidity increases, patients can lose mobility. This includes in the chest and can reduce chest expansion, which can cause breathing issues. So to diagnose ankylosing spondylitis, we're going to check labs and imaging. You're going to see elevated nonspecific anti-inflammatory markers such as C-reactive protein and SED rate in approximately 70% of patients, and you'll see the presence in 90% of patients of the human leukocyte antigen HLA-B27. This is not specific, but is in most of patients. On imaging, you're going to see evidence of sacroiliitis or bone marrow edema on X-ray or MRI, spinal lesions on the X-ray. In the later stages, you're going to see ankylosis or fusion of the spinal facet joints on X-ray or MRI. You're going to see syndesmophytes specific to only a few types of arthritis, including ankylosing spondylitis, which are calcifications of ligaments that form spurs. Eventually, these spurs will link, and this will be called bamboo spine, which is representative of the vertebral fusion of the syndesmophytes by the disease process, and you can see this on X-ray and MRI. The pathology of ankylosing spondylitis is, we know that HLA-B27 contributes to the disease. We don't know how, as a strong genetic component, and then it also has an environmental factor, but again, we don't know how those play into effect. Ankylosing spondylitis has a distinct pathological changes at the enthesis, which is where the area in which a ligament or joint capsule attaches to bone. This is called enthesitis. The inflammatory component of the disease causes bony erosions at these bony attachment. The body tries to repair these erosions, and this repair activity results in ossifications at these sites, which result in further inflammation and syndesmophytes. Over time, the syndesmophytes link or bridge, causing the spinal fusion to become more rigid. The inflammation repair process is the driving force of ankylosing spondylitis, causing structural damage. It is believed that tumor necrosis factor, TNF, is a contributing cytokine that causes unregulated inflammation in ankylosing spondylitis. So some treatment options are NSAIDs, corticosteroids. A third line is disease-modifying anti-rheumatic drugs, such as sulfasalazine, and then biological medications, which are the new popular up-and-coming treatment. TNF inhibitors, such as Enbrel, Remicade, Humira, and then for patients that those don't work, is going to be Cosentyx, which is interleukin 17A. Patients also may have to resort to narcotics, unfortunately. There is no cure for ankylosing spondylitis. Most patients with ankylosing spondylitis lead a full life. However, those with high disease severity have decreased life expectancy due to cerebrovascular disease and pulmonary fibrosis. Quality of life can be diminished by pain and mobility issues as the disease progresses. As this is a young man's disease, it can take years to diagnose, which can lead to anxiety and depression. Anxiety and depression is also linked to pain and mobility issues. Other comorbidities include osteoporosis, uveitis or inflammation in the eye, inflammatory bowel disease like Crohn's and ulcerative colitis, and heart disease due to inflammation like aortic valve disease. Some differential diagnoses are mechanical back pain. This is often due to injury or wear and tear of the joints. Now, compared to ankylosing spondylitis on imaging, you'll just see damage on one side or wherever the damage is, whereas ankylosing spondylitis is going to be symmetrical on imaging. So you're going to see it on both sides of the hip, buttocks, wherever it is. Another differential diagnosis is rheumatoid arthritis. Common symptom is joint pain. It's not associated with the HLA-B27 antigen, however, and rheumatoid arthritis is a peripheral arthritis, and sacroiliitis is very uncommon in rheumatoid arthritis. A fun fact about ankylosing spondylitis to help you remember this disease is Mick Mars, the drummer for Motley Crue, and Dan Reynolds, the lead singer for Imagine Dragons, both have ankylosing spondylitis. Hope you enjoyed my presentation.